Dr. Beverly Reed.
And I'm Dr. Amber Klimczak.
And we are
Two Peaks in a Pod.
Well, hi, welcome back, everybody. I don't know if you can tell, but I just got soaked.
It's pouring.
It is pouring. It has been raining so much, and I made something up. So have you ever heard of how if somebody gets married and it's raining, it's good luck?
Yeah.
So we decided if you have your embryo transfer today or your IUI or something today, you're going to have good luck because it's pouring.
Or all week. It's been storming all week. We were without power for 2 days, which is miserable.
I'm actually even going to show. I've got rain boots on. Do you want to show what you have?
Nothing.
Poor Dr. K is so soaked. You guys can't see it if you're just listening, but you can see it on the YouTube. She got so soaked that she had to take her shoes and socks off, and she is podcasting barefoot right now.
It's miserable to have wet socks. It's like the worst.
We are a mess today, so don't judge.
Yeah. Okay, so Dr. Reed,
yes.
what is the worst medical advice you've ever been given?
Oh my gosh. Oh, I feel like there's so much bad medical advice. That I've been personally given, though. I don't know if I can even think of any. I'm not good on the spot. I feel like it's going to take me too long to come up with something. I know you've gotten some bad. I can remember some of the bad medical advice you've gotten.
I have had some really interesting medical advice from doctors and, just friends and family sometimes.
My favorite part is that you were told you did not have a fertility diagnosis.
Mm-hmm.
They told you don't have PCOS.
Yes.
And then you became a fertility doctor and you really showed them.
Well, I was just like, wait a second, I do have PCOS.
Yes, you had to diagnose yourself and say, excuse me, did I really have to do all this training to tell you that indeed I do have PCOS?
Yes. So I have an older sister. I always knew, hopefully she doesn't mind me sharing her health information, but she doesn't we can
always
listen to
edit
this.
It out later.
Yes. I have an older sister.
Yeah.
She looks just like I do.
Oh.
And she has PCOS, right? We're like very similar.
Yeah.
And she was diagnosed.
Mm-hmm.
She kept telling me, I think you have PCOS.
Mm-hmm.
Everything you're saying is what my doctor told me. I went to my doctor. I think I have PCOS. My doctor's, no, I can tell just from looking at you, you don't have PCOS.
Hate that.
So ridiculous.
Yeah.
There's very few diseases, I think, that we can tell just by looking at you. So probably just, general medical advice, maybe don't accept that as an answer.
Well, okay. Now that I'm thinking more about it, I think I know why I can't come up with an example for you because I am a horrible patient. I never go to the doctor.
Oh my gosh.
This month I need to get my mammogram done. I should have had it done 6 months ago. Don't use me as an example.
Oh my gosh,
I know. I'm a really bad patient. So I guess maybe, that's my problem is I need to go to the doctor.
You need to frequent the doctor to get some bad medical advice.
Right. So it's on my to-do list. So.
Okay. Well, I was looking and I came across a lot of really bad celebrity medical advice.
Oh, but I love celebrities. Are you sure it's bad advice?
I think that celebrities have a really good platform,
yes.
right? People will pretty much do anything that a celebrity validates and tells them works for them, which is really dangerous.
Okay, I agree. I have heard some bad things. Sometimes I hear some good things too.
Yes. Yeah. It's wonderful when they use their platform to educate and bring awareness to new diseases and things like that. But sometimes it's just downright bad.
Mm-hmm. Okay. Do you have some examples?
So we're going to talk about some really bad celebrity advice, somewhat related to the field of fertility that has been circulating out there. You've probably heard of some of these, maybe not.
Fertility or women's health?
Women's health. Yeah. Yes, exactly. So I think one of the biggest people out there who really likes to kind of, delve into a little bit of health, wellness, Gwyneth Paltrow.
Oh gosh. Yes. See my eye roll already.
First of all, I think Gwyneth is a phenomenal actress. She's gorgeous,
so
right?
Pretty.
Yes.
Oh my gosh. Yes.
Yeah, she's doing something right with her.
Oh my gosh, she really is. She does look amazing.
She does. It's funny. Actually, I was listening to another podcast when she came on, and it was all men that were interviewing her, and she signs off, and they're all like, "Oh my gosh, we're in love with her." Yeah, she's very charismatic.
Yes. Charming, beautiful.
Yes. So I think I understand why so many people maybe listen to her, but she has this whole website, right? Called Goop.
Yes, I've heard of Goop. Yeah.
She sells a lot of, I think, cosmetics and all of her sunscreen, I think, is really, really popular. I think we actually have her sunscreen, but a lot of the things she does are a little bit strange,
Mm-hmm.
I would say.
Yeah.
I've heard of some candles actually that she has,
that was coming to mind, but then I'm like, was that her or was it somebody else?
I think it was
her.
Are we
talking about vagina candles?
Yeah, I think she's the one that piloted the vagina candle.
What does that mean, a vagina candle?
I don't know. Okay. It just would not be a good scent.
Right?
I really hope it wasn't a scent.
So that was supposed to be the scent of the candle?
I don't know.
Oh,
I just don't know.
Yeah.
Maybe her smells nice. I'm not sure. But she recently has been a proponent of vaginal steaming.
Yes. Okay. I've heard of this. Okay. Vaginal steaming. Okay.
Yes.
Okay.
So I guess it's not exactly douching, right? Okay. But it is sort of like cleansing your vagina. Mm. And she says that it really corrects hormonal imbalances.
No.
Okay.
What do you think? Did she really say that? It corrects hormonal imbalances? No, hormones don't come from your vagina. Oh my gosh, Gwyneth, we need to talk. Okay, well, first, let's just touch on the douching thing since you brought that up.
Yes.
Too. Okay, douching, you should not do. Okay, what is douching? Douching means you're trying to clean the inside of your vagina. Sometimes they do it with some sort of like home mixture of, I think, like vinegar and maybe water, or like really any kind of mixture of anything you should not put into your vagina. Here's the thing, the vagina is really cool. It's a self-cleaning machine. And you don't have to do anything. What's really cool about the vagina is we have a very harsh pH level in our vagina that kills off bad bacteria. And the good bacteria called lactobacillus is able to flourish in this pH environment. So the problem is when you douche and you use like a vinegar mixture or anything like that, in the moment you may be like, oh great, my vagina is nice and clean. But what you've done is you've washed out all of the bacteria, including the good bacteria. And when you don't have the good bacteria there, then the bad bacteria like to take over. And that actually puts you at higher risk of getting recurrent vaginal infections. So we are anti-douching.
Absolutely. Mm-hmm. Yes. I kind of thought douching was on the way out. I didn't know that people really douche anymore. So
I've learned it's very cultural.
Oh.
Yes. Like some women will say like their mother maybe taught them to douche and they kind of just keep passing it on. But we're really trying to just break that and say, nope, you don't need to do it. And even like there are some products that are sold in stores, where it's a vaginal cleanser and this and that. You don't need to do anything. So for care of that area, all you need to do is use a very gentle soap, preferably unscented, fragrance-free, and just wash around the vulvar area. That's the external part. You don't need to go in at all. And if you're like, but Dr. Reed, I'm having some weird odors or something like that, then you probably do have a vaginal infection, in which you should see your OBGYN. They can do swabs to diagnose your vaginal infection and treat you. And then maybe afterwards, you might want to do a little vaginal probiotic to replenish the good bacteria in the vaginal area to try to prevent future infections, but definitely don't douche.
Yes, such good information. One of the vaginal probiotics I've been recommending to my patients goes by Good Girl. Have you heard of that one?
No.
Yeah. My patients have had good results with it. You can take it if you've ever had bacterial vaginosis is one of the common ones that Dr. Reed's talking about, and you can actually take that along with the treatment when it heals.
Great. I've been using or recommending one for my patient called Biome. I like it because you can get it on Amazon.
Yes.
So nice when you just Amazon something.
Right?
Yes. So yeah, that's great. Okay, but so that was kind of about douching. So steaming, I guess, sounds kind of similar, except now we're adding heat.
I know. I'm really nervous about the heat. Really nervous about the heat.
Yeah. I mean, first, like, I would think that would hurt if it's, what if you get it too steamy or too hot or something like that? I'm like, that doesn't sound good. And then how bacteria love to thrive in a nice, warm, moist environment. I'm like, that doesn't sound like a good setup. So I just don't know why anyone would, number one, need a steaming. And I feel like it could cause problems. Don't you think?
If you were going to get burned anywhere, I think probably the worst place would be the inside of your vagina. So I would not recommend putting heat anywhere near the area. And that tissue is very sensitive, and I would imagine it would slough off and hurt really bad. So I definitely would not put a steamer anywhere near your vagina.
You just don't need it.
You definitely don't need it.
Oh, and so Gwyneth, where do the hormones come from? Okay, the hormones come from the ovaries, and since the ovaries are inside of our body, steaming the vagina is not going to affect the hormones one way or the other. And so if you need some kind of hormonal evaluation, that would just be totally separate from anything going on in the vagina.
Yes. And also the other thing is, if you are trying to conceive or thinking about being pregnant, we really don't want high heat exposure around your uterus, anything like that. So just another reason to be careful.
Okay, so we're going to say, Gwyneth, please stop giving gynecologic advice.
Yes, yes, exactly. Okay, so this one I think is pretty common with a lot of our patients too, but Katy Perry, she takes 26 vitamins and supplements a day.
Oh my gosh.
Highly recommends it for digestive health, well-being, all of these other things, right? So it was interesting when I was reading about this, they said that 23,000 ER visits a year are solely due to vitamins and supplements.
Oh my gosh. Wow. But that's just so many supplements and vitamins. She's so healthy. Why does she need that many?
Yes. Yeah. The vitamins and supplements, I think, are a really big trend.
Yeah.
Right now, people want to do anything they possibly can to improve their health and wellness.
Yeah.
So I know you like a lot of supplements, vitamins that are more validated.
Yes.
So Dr. Reed, how can we decide what's worth it, what's not? How can we guide our patients?
First, I just want to share my experience, which y'all may have heard on a prior podcast, that I wanted to do an experiment on myself. So there's this supplement, I won't even name it necessarily, but there's a supplement that claims to be anti-aging. And so for some of my patients, they're taking it for their ovaries. Okay. But even though I don't care about my ovaries right now, I just want to look young. So I'm like, okay, maybe I'll try it. But I was going to say, while I'm trying it, why don't I do an experiment on myself where I'm going to check my egg count level, called AMH, before and after taking this supplement for 3 months. So that was my plan. I already checked my AMH. It's low because I'm older. Here's the problem. Remember to take a supplement every day. I'm a horrible patient. I have it sitting next to my sink and I see it every day. And for some reason, my brain just like completely dismisses it. I took it one day and I've been non-compliant ever. It's the worst study ever. So I really need to do the study. But I would say, number one, it takes a lot of dedication to take 27 vitamins and supplements every day.
I think it would upset your stomach.
Yeah. But I will say one of the most important ones that we know is proven in studies is folic acid. Any and all of our patients have been told you need to be taking folic acid every day, ideally even 3 months before trying to have a baby. We know it lowers your risk of having a child with birth defects or autism and lowers chance of miscarriage as well. And then I think you and I have both been a fan of vitamin D lately, right?
Yep, definitely. So we know that most people out there are probably vitamin D deficient. Nowadays, we just don't go out and sun ourselves. That's just not how we live. We're all scared of getting skin cancer. And vitamin D is mainly absorbed through the skin from sunshine. And so what we do is we usually recommend supplementing with about 2,000 units daily for our patients. If you're not good at taking it, sometimes you can get a higher dose just once weekly. It's really nice. Vitamin D, you're not going to absorb that much, right? So you want to take it with food as much as you can. You can try and get a lot of it from food, but I do think it's one of the few supplements that's probably worth it to take.
Yeah. I would say maybe another popular one that I do support is coenzyme Q10. For folic acid and vitamin D, I tell all of my patients to take that. For the rest of the supplements that sometimes I'll talk to my patients about, it just kind of depends on what's going on with them. So for my average patient who maybe doesn't really have any egg number or egg quality problems, I don't really feel like they need to do anything beyond that. However, if I do have patients where I'm worried that their egg counts are dropping or that their egg quality is lower than I would like, then I do usually have an additional list of supplements that I at least offer to them. It's so hard because these supplements aren't proven, but they're at least things that I don't think are harmful and that may help. I think our biggest beef with all these supplement companies is if your supplement truly works, show us a study.
Right.
Give 100 people the supplement and 100 people a sugar pill and show us the difference. And none of these companies will do that, which makes me feel like, is it because it doesn't really work or have that much effect, right?
Right. Yeah. Having that highest level of evidence, which we consider a randomized controlled trial, just simply doesn't exist for most of the supplements out there. The other thing that we really always caution our patients about is that supplements in general are not really regulated, right? They don't have any type of third-party testing that's guaranteeing that they're actually containing the ingredients that they advertise. There's very few that are actually regulated. Many of them now are actually getting better, and they will post, if you look like on Amazon for these things, they'll post that they've been third-party tested. You kind of have to make sure it's reputable.
Yeah.
But I would say be diligent about what you're testing. And it's really important for our patients because they may have an unborn fetus in them, right? And we want to protect them from anything that could potentially harm them or just unknown. So I always caution my patients to try and look at where are they getting their supplements from if they're going to do it. most vitamins are water soluble, right? So Katy Perry's urine is probably worth its weight in gold. That is a lot of vitamins that she's probably peeing out. Water soluble means that most vitamins are just going to come right back out your system. You're going to urinate them out. It's best to get your vitamins, if you can, from the food that you eat daily. And you can be really thoughtful about it and get it. This is probably us not being good examples, but both of us don't always really think about ingesting all of these throughout the day, but I do have patients that are actually really, really good about it. And when you teach people what's, certain foods that you can get some of these vitamins from, I think you can be thoughtful and get it all from your diet.
I totally agree. We both are big supporters of the Mediterranean diet, where you're trying to incorporate healthy seafood and lean protein and veggies and healthy grains and things like that. So if you are following a really nutritious diet like that, you probably don't need any other supplements. If you are somebody who is, eating McDonald's 3 times a day and you have no plans to change, then yes, maybe supplements are more likely to help in that case, because maybe you aren't getting enough vitamins and nutrients like you should be. So probably dependent on the person, but I do agree that focusing on really good diet and nutrition should be the prime goal there.
Yeah. Okay. So
can I tell you one more analogy too?
Yeah.
Okay. So, because sometimes people say, how much are the supplements going to help? And I just think this is such a good analogy.
Yeah.
Okay. So let's say you've got an empty pool in your backyard and you fill up a glass of water and you throw it in the pool and you're like, did that help fill up the pool? Right. That's kind of how supplements are, I think, is okay, sure, it helped a little bit, but is it going to fix major issues? Is your sperm going to go from 1 million to 20 million? No, it's not. I've never seen that happen from supplements alone. Mm-hmm. And is your AMH going to go from 0.5 to 10? No, it's not. But could you have very small improvements? Sure. And so I'm always supportive of helping and not hurting, but we also want to make sure that we're using what we really need, which is sometimes our fertility testing and treatment.
Totally. Yeah. I completely agree with helping, not hurting. The other thing that sometimes I caution my patients on the way that it can hurt them is monetarily.
Yes.
Sometimes supplements can be really expensive. So especially I've heard kind of, even for example, for semen analyses, I've heard of some mail-in semen analysis kits, and then they sell you back supplements to fix your sperm. And I'm like, okay, but how much are the supplements? Oh, they're just $1,000. I'm like, that's a lot of money on supplements.
I saw an ad for fertility tea the other day. $400 for fertility tea. And it said it had a 95% chance of working. And I'm like, I wish, if only we could just give people tea.
Yeah. 95% chance of working for who? Like a bunny rabbit? Like, no one has that high of fecundity.
I know. But it just goes to show you you can say whatever you want.
Yeah.
Right?
Ridiculous.
Yeah.
Absolutely ridiculous. Okay. So do you know who Shailene Woodley is?
No.
She's really cool. I feel like she's like the cool actress. She's been on a couple HBO. She's been I'm trying to think about some of the movies. I'll have to look her up afterwards and show you. She's younger than we are. She's hip.
Okay, I guess that's why I don't know her. I'm not cool enough to know her.
She's actually a really good actress. Okay. I think she's won some awards and everything. But Shailene Woodley likes to and recommends exposing your vagina to the sun, actually, to absorb vitamin D.
Okay, well, first of all, can I just say that would be impossible? Because, we need to educate everybody on the correct names of our parts, which is the outside is the vulva and the inside is the vagina. So how would you even expose your vagina to
a dark tunnel?
Unless there's some kind of like UV probe that you could put in there or something. So, so no.
Yeah. What do you think about this?
I don't even know like where this would come from, but I already disagree with this. And I also think like, how? I can't get past the how part.
Yeah. You know, what was taught to me in medical school, obviously we're not dermatologists, but we were always taught 15 minutes hands and face, actually once a week is probably sufficient to absorb enough sunshine. I was not told that your vagina is especially good at absorbing it. I don't know why it would
Remember when we had our dermatologist on the podcast? I wish we could like consult with her.
Yes.
Where is this coming from?
Yes. Yeah. Interestingly, I have heard of people having skin cancer and things on the vulva.
Yeah.
So, I don't know if it's especially sensitive. I have no idea. We're not dermatologists, but
Yeah.
I would say I probably wouldn't expose an area to like that. You're probably not putting sunscreen on, down there that might burn.
Yeah.
So, I would say no.
Yeah, I agree. Bad celebrity advice.
Yeah.
Wouldn't take it.
Yeah, definitely. And also, if you're going to do it, maybe like privately in your backyard. And like nowhere's really private anymore with drones and everything. I don't know. I'm paranoid.
Yeah. So we're going to say,
you have to really let yourself kind of hang out there to do that. Okay. So Miley Cyrus, obviously, Miley.
Wrecking ball.
I actually love Miley Cyrus. So
okay,
y'all, Dr. Reed is a huge Swiftie.
Yes.
She loves Taylor Swift.
Yeah.
Okay. I would say I also like Taylor Swift's music, but
I feel like that didn't even sound believable.
I do, but especially her new stuff, sometimes I just don't get it. I feel like I'm just not on the same level.
Get it?
I know my patients are gonna be mad at me because I have a lot of Swiftie patients.
Yeah, just switch to me, y'all.
I have actually planned a lot of babies around these Taylor Swift concerts. This last year has been a challenge for me with frozen embryo transfers between all of these, especially she's in Europe right now, right? So like all of my patients are going to Europe. Anyways, I love Miley's music though. Oh my gosh. I'm not going to sing for y'all, but some of her music is just so creative. It's just kind of like edgy.
I'm just not into Miley.
Personally, I don't want to be friends with her, but I like her music. I don't think she would want to be friends with me either.
Maybe a few of her songs I like, but like I feel like with Taylor, I like all of her songs. It doesn't matter what it is. With Miley, I'm like, okay, like you have an occasional song that
okay, but that song like sweater or cardigan,
the red sweater, something about the red sweater, the red cardigan. It's like the 10-minute song or something.
I don't understand. Okay. See, I'm just like not there with her. Taylor and I don't see eye to eye.
Okay, so Miley, did she give us some advice?
So she, she's pretty thin. Yeah, I don't know. I think she's always kind of been thin. That's just sort of how her physique is, and people love to critique celebrities. Yeah. I'm sure that's probably maybe just like her natural set point for her body. But I don't know. Maybe not.
Well,
I'm not sure.
She did have a drug phase.
Oh, she did? I don't know. Now you're telling me bad things about my artist.
I'm just saying, like, sometimes how if you're using drugs, there are certain drugs that can make you very skinny. So I don't know if that's related. Not even that's any of my business. But,
okay. Could be that. Yeah. But I guess she came out and said, oh, you all need to go gluten-free. I'm gluten-free. Okay. And so when she went gluten-free, she said that her body, like her muscle, all these things, so much better. So she's like, everyone needs to go gluten-free. So I have some in-law families, that are gluten-free. I think it is a huge hassle. So what do you think about everyone going gluten-free?
I think we need to give a shout out to Nurse Julie. You may not know this, but she's gluten-free.
Oh, really?
And it's ruined our lives because like every time we get food delivered and that kind of stuff, it always has to be from somewhere that has gluten-free food and all of this. It is very hard to work around gluten-free, but I will say there are certain medical conditions that we feel, that we know will improve with a gluten-free diet. So the most obvious one is celiac screw, which is a gluten intolerance. I do have an aunt with that. She has to follow a very strict diet because if she eats gluten, she will get very sick. So I do think that's true. For certain people, they need to go gluten-free for their health. And besides even celiac screw, there are some other conditions that people say seem to have just made them feel so much better. Like some people who have Hashimoto's thyroid disease or really just anybody with any digestion issues. Some people just feel so much better if they go gluten-free. If you have migraines, for some people, it's just such a trigger. And I always think about it this way, is we all respond differently to different things. So for example, if I put on Dr. K's gloves, I will get a terrible rash.
True.
I will be itching. I will be bleeding. I will have scabs on my hands, right?
She means the type of gloves I use, not that my own gloves are infested.
Like medical gloves. Yes, I know. But because here's the thing. I've had allergies allergy testing done, and I have a reaction to a chemical in what's in most people's medical gloves. So I'm high maintenance. I have to get very special medical gloves ordered for me. But so you can see how I would go around and tell everybody to avoid that chemical. Well, not everybody needs to avoid that chemical, but I need to avoid that chemical, right? That's how I feel like it could be with so many different things, whether it's medications, whether it's chemicals, whether it's certain things in their diet. So that's kind of how I feel about gluten too. For some people, they need to avoid it. For some people, it's probably okay.
What do you think about gluten-free and fertility?
Okay, so there are certain conditions where they think it may help to go gluten-free, but because I haven't seen any proof, I don't necessarily recommend it for people yet. But I've definitely heard some people feel like it improves certain fertility conditions like endometriosis or things like that. The problem is, again, I want somebody to prove it to me. Do a study. 100 people go gluten-free, 100 people don't, and let's look and see, did their condition get better, right? And I haven't seen that data. But anytime I have a patient who tells me, look, I went gluten-free and I feel better, then I'm like, great, go for it. But I do have one concern, which is sometimes to go gluten-free, you have to go low carb. And I do have concerns about low carb diets in fertility patients. And this will be a side rant because there is a doctor who I will not name who tells all fertility patients they need to go keto. They're like, apparently he tells everybody, you're not getting pregnant, it's because you're not doing keto. Oof. And I, when I hear this, I'm like, okay, where's the study? Let's see. There are no studies proving this at all. Okay. But more so concerning, there is a study showing that women on low carb diets have a higher risk of having babies with neural tube defects. And why would that be? I really tried to dig into this because I'm like, this is concerning. Some people say, well, carbohydrates are oftentimes fortified with folic acid. And you heard us before say you need to be taking folic acid, right? And so the logic there was if you're not getting carbs, and then you get less folic acid, maybe that's the issue. But here's the thing. They did a sub-analysis in this study of women who were taking a prenatal vitamin that had folic acid in it. So they should have corrected for that. And they still had a higher risk of birth defects. And so I tell all my patients who ask me about low-carb diets, no, you should not do a low-carb diet. Mediterranean diet is going to be the healthiest for fertility and
yeah. And the way I also describe it to my patients is, especially if you're going to go through treatment and you have to be going through IVF and things like that, we're trying to make multiple follicles grow, right? Way more energy than your body is used to doing in a month. Yep. And your short source of energy are just carbohydrates, right? Yep. That's what gives your body immediate energy. And so to take away that fuel during a really energy dense time, it makes me really nervous. So I definitely don't want people to be keto when they're going through treatment.
Absolutely.
Yeah.
Okay, good. Do you have any more or should we wrap it up?
Let's see here if there's anything else interesting. Okay, this one comes up a lot, and this is sort of related to what we do. Okay, eating your placenta.
Oh, gross.
Okay.
Please tell me you did not eat your placenta.
Of course not. Okay, but January Jones, who, maybe one of the most beautiful actresses out there.
Yes.
She says you should eat your placenta. No. Okay, first of all, where does this come from? Why do people think that you should eat your placenta? It does have a little bit of maybe something behind it.
Apparently animals do this. When they give birth, they eat their placenta afterwards, and it's supposed to give you nutrients in your body, especially too, like when you deliver a baby, you can have bleeding, right? And so you might get anemic or something like that, and they say the placenta can help restore those nutrients. But I'm like, you could take an iron pill if you need to,
or eat a steak.
Yeah, you don't need to eat your placenta, but also some people feel that it decreases your risk for postpartum depression.
I haven't heard that.
Yeah, but I'm also like, there are other things we could do to help you with that,
Yeah, more sanitary.
And I wonder if the people who want to eat the placenta have seen their placenta, right? Like you and I have both delivered so many babies.
They're nasty.
No, it's not. You just take one look at it, you're like, nobody should be eating that. No. And here's the thing too, like the placentas, some women, whenever they're delivering, especially if you're delivering after your due date and everything, what can happen is the baby can have meconium. That means the baby has a bowel movement while the baby's still inside of you. So imagine the placenta comes out and it's stained with baby poop. You're going to eat that? No, ma'am.
Do they cook it? Like, how do you even eat it? I don't really understand.
Well, I heard what they do is they chop it up into little pieces and they encapsulate it. So you take a capsule that you swallow.
Okay.
But still, no.
Yeah, not worth it.
We don't need to do that.
Definitely not.
We're against that.
Oh
Another
gosh.
X.
Yeah. Okay. I think that's enough bad celebrity advice.
Maybe we should have an episode of good celebrity advice too.
Yes, because there is some out there. There really is some out there.
Yes.
Yeah.
Okay, great. Well, I hope you guys have a great week. If you have the time, if you would do us a favor and leave us a good review, we would greatly appreciate it. Thank you.
Bye.
Bye.